So our group looked at the best evidence for lower extremity orthoses to prevent knee injuries in athletes. So for the first article, it was titled Effects of a Prophylactic Knee Sleeve on Anterior Cruciate Ligament Loading During Sport-Specific Movements. So for some background, it was a prophylactic knee brace is used greatly in the world of sports to reduce high risk of injuries during practice and competition. ACL injuries are very common in non-contact and contact sports. Excessive loads may cause tearing and result in an athlete to miss a significant amount of playing time. So the purpose of this article was to examine the role of a prophylactic knee sleeve on ACL loading parameters, which are linked to the pathology and injury in recreational athletes.
So the methods employed in this article, there are 13 male recreational athletes that were split into two groups, one with the Don Joy Trizone knee sleeve, which is in the top right corner, and the other group without the knee sleeve. So they were asked to complete 5 repetitions of 3 sport-specific movements that included running, cutting, and single leg hop. Each participant wore the same shoe size ranging from 7 to 10. Kinematic data was captured using motion analysis system and ground reaction platform. An example of that is on the bottom right. Interpretation of results. So here's a table of the results. Just some summary from it was movement analysis found that ACL loading is greatest during the hopping and cutting motions. Load rate was significantly reduced during hopping and cutting while the participants were using the sleeve. And they also found there's no differences between participants wearing the sleeve and not wearing the sleeve while they were running. So the potential impact of this article, the current research is limited with the effects of prophylactic knee bracing and ACL injuries. But in this study, ACL loading parameters were significantly reduced in hopping and cutting movements while the participants were wearing the prophylactic knee sleeve. ACL injury risk is greatest during these movements, the hopping and cutting, and these movements are found in decelerations, landing, and pivoting motions, which proposes that athletes may be able to attenuate the risk from injury during the cutting and hopping movements while wearing the sleeve. But this article did not talk about the potential disadvantages of the sleeve, which include slipping off, the comfort of the sleeve while the athlete is performing, and their ability to reach peak performance while wearing the sleeve.
So for our second article as part of our literature search, this was a study done in 2018, which looked at the effectiveness of prophylactic knee braces in protecting the knee against impacts or tibial moments. So what was interesting about this study was that it was done in an in vitro multisensory setting where they used the knee braces on actual cadavers or knee cadavers. And the article did mention that these types of experiments were done before. However, findings were often inconclusive or were not as significant. There are also previous studies that only looked at the lateral impacts of the knee, so only looking at that valgus moment. So the purpose of this study was to investigate whether bracing protects the knee against impacts from multi-directions, lateral, medial, anterior, or posterior, and at different heights as well as different tibial moments. So this is a controlled lab study, and they used 8 leg specimens, 2 male, 6 female, with the average age being 70 years and a standard deviation of 12. This was tested in the braced and unbraced with the position of the knee in 30 degrees of knee flexion, and they were measuring the subcritical impacts in the medial, lateral, anterior, and posterior direction. And if you look at the picture, they used I believe it was a weight and a lever, kind of like a catapult system, where they would hit the knee joint at different heights, one at the center joint line, one 100 millimeters inferior to the joint line, and 100 millimeters superior. And then they also measured the internal and external torques. So the outcomes they were measuring was the change in ACL strain, the joint acceleration in the tibia and femur, which they measured using 2 sensors implanted in the tibia and the femur, and they were also examining joint kinematics.
Interpretation of results. For this slide, I will interpret the results with the brace on compared to it off. Some of the key findings we had from the results included reduced joint acceleration for medial and lateral, as well as center impacts. The ACL strain decreased for medial and superior impacts. However, it did increase for anterior and inferior impacts. Posterior impacts had better results than the anterior in terms of ACL strain and joint acceleration, and there were no effect on ACL strain or kinematics under internal or external torque. So what does this all mean? Bracing might be beneficial in contact sports with many lateral or medial impacts, whereas sports with rotational movements on the knee or anterior impacts might be safer without a brace. Even the researchers of the study admit that there is no simple answer to this question of whether prophylactic braces actually do protect the knee during sports. As we know, sports is a very general term, but even if we think of the major sports we have in the US, most of them are they're in an open environment, and very few, if any, are solely performed in the frontal plane. Now, some could argue that some sports that are mainly performed in the frontal plane could benefit from these prophylactic braces. But what about the increase in incidence of injuries when there are twisting or rotational components to these sports? As of now, there is not a conclusive answer to this question. However, there may be benefits to wearing a prophylactic brace in an appropriate, controlled environment. But there are also inappropriate times to be wearing this brace that can lead to a higher incidence of injury.
So for the third article, it's titled The Effects of Prophylactic Knee Bracing on Knee Joint Kinetics and Kinematics During Netball-Specific Movements. So for the background, this study looked at the prophylactic knee braces. And so what they are is they're external non-adhesive devices utilized in dynamic sports in order to prevent knee injuries without reducing knee mobility. So for this purpose of this study, though evidence to support their efficacy is limited, this article investigates the effects of the prophylactic knee braces on knee joint kinetics and kinematics, like I said, during the netball-specific movements. So for methods employed, this study used 20 female netball players. They were each university first team level players. They each had a minimum of 3 years competitive netball experience, and they each were free of a lower extremity pathology within the past 5 years. So what was used was a single knee brace. It's called the Trizone DJO. It came in small, medium, or large sizes to accommodate all the participants. It is a silicone compression sleeve with circular knit construction, and it was worn on each of the player's dominant limb, and specifically for this study, it was the right limb. And the kinetic and kinematic information were synchronously obtained and interfaced using the Qualisys track manager. So during the data collection, it was collected during running, cutting, and jumping movements. The participants commenced movement at a minimum of 20 feet away from the platform, and it's a forced platform. So with running, they started their run at a 4.0 meter per second jog or run, and they each struck the platform with their dominant limb. During cutting, again, they approached the platform at a 4.0 meter per second jog with their dominant limb, and once they hit the platform, they were required to change direction to the opposite side at a 40-degree angle. And then lastly, with jumping, it was considered a counter movement vertical jump. So they commenced and landed on the forced platform. And when they began, they started with a full arm swing, and they had to land in maximal knee flexion for it to count.
So with the results of this study, when looking at the kinetics, knee joint kinetics were not affected by the knee brace. And this chart just shows that when looking at the force and the pressure at the knee joint. As far as the kinematics, on the next slide, we can see that there was decreased transverse plane internal-external range of knee movement in all movements. And once again, it's specifically in the transverse plane, there wasn't a significant difference in the sagittal plane. There was also an increased perceived knee stability as per subjective report. And then we also included that further studies were needed to see if this reduced tibial internal external rotation actually reduces injuries in the long term. And then also to assess various types of prophylactic knee braces, as only one type was used in this study. And then on this one, we can see the chart showing, again, highlighting the transverse plane range of motion. And you can see that there was a significant difference between no brace and wearing a brace with each of these different movements.
So for potential impact, based on this study, prophylactic bracing doesn't seem to affect knee kinetics during the running, cutting, and jumping movements, but it does seem to reduce the tibial rotation peak range of motion and increases the subjective stability in the netballers. Current aggregate research is conflicting, and further studies are warranted before recommending a prophylactic brace to prevent injuries in athletes that you're going to be treating in the future. And then in terms of stability, like I mentioned earlier, significantly more participants found that the knee brace improved stability during those netball specific movements.
So our clinical conclusion, research is still very limited and conflicting about whether these prophylactic knee braces actually prevent knee injuries in athletes. Further long-term studies are warranted before recommending use of one of these braces for athletes. And then we also must consider other proximal and distal joints, long-term use implications and compensations, as well as psychological dependency.
So across all three studies, we did notice some flaws. In the first study, we noticed that there was a small sample size, as well as being all one gender, that being male. And this study did not look at any long-term effects of the prophylactic knee sleeves. It just showed all acute findings. For the second study, again, it was a small sample size, but this time it focused more on females than men in a more than 3-to-1 ratio. And this is important because females have been more prone to ACL tears during sports than men, and the actual effect of impacts might be smaller for male athletes. We also noticed that this was an in vitro study, considering they used cadavers, and it was making it hard to place the DVRT sensor in the same exact spot on each specimen. And for the last study, some flaws we noticed were that it was performed in a closed environment where everything was fully anticipated, controlled in a laboratory setting, which is not as realistic for athletes where they perform in an open environment. This study also had a small sample size with all female samples, and this study had no injuries reported. So again, they have no long-term effects on the study.
Clinical review for each article. As you can see, none of these articles fulfilled any of our specific criteria. This isn't to say that these studies are not good, but these studies don't mention a diagnostic or a reference test. We did find a strong meta-analysis, but it was dated too far back. As we mentioned, research in this area is very limited. Here are the links to other articles that were mentioned. Hope you enjoyed.